Well, welcome to episode 3 of Citywide Cogs, where we sort of get behind the scenes and work out how we're trying to do church online. Right up front, when all the COVID-19 stuff hit, one of the big questions was how do you care for people when you can't see them, when you can't, be together, and particularly in a time where care is of higher importance, where we know that a lot of people are losing jobs. Not only was there the potential of a major health issue, and that still remains a possibility, although it looks like we're here in Tassie, we're getting on top of it. But there's a lot of emotional support people need, and there's a real danger of social isolation at the moment. So we had to work hard to work out how do we create a system to care well. So we had a discussion, and we built a care team. I'll get Dan to share more about that. But in order for the care team to work well, I brought Neil into our first meeting of the care team and said, mate, we need to create a system because we can't trust everybody's memory to see how everybody's going. And we've seen that time and time again at the moment. We need a system to care for people. And thank goodness Neil is pretty good with systems. So, mate, what did we do?
So when you asked me to look into that, my first response was to see what I could find off the shelf. So I spent a fair bit of time looking high and low. It seemed like out there, there are systems, they're called CRMs or customer relationship management systems. There are even an adaptation of that called CHRMs. I don't know how you say that, but CHRMs, which is church relationship management systems. They're all available, but it seemed like they were either too simple, they were just so basic that they wouldn't even cater for the simple approach that we were looking at, or they were so complicated that we would be up for probably a month's worth of training just to be able to get the use out of it. So it didn't seem to be that there was a solution in that direction. So then I thought, well, okay, I'm able to build this sort of stuff, I should look at that. But rather than build from the ground up, we're already using Planning Centre for so much of how we run church. And it seemed like that had most of the bits and pieces that we needed. And given that all the data was there, we already have most of our people in Planning Centre. We already have most of our groups in Planning Centre. We already have our services there. I thought, well, let's see what we can do. So what I've done is built a wrapper around Planning Centre, which we're calling Citywide Care. And that's just a care page, which Dan will show you in a minute. And that basically takes the functionality that was in Planning Centre in separate parts and brings them together into the system that we needed. So essentially what we've done is use the groups area of Planning Centre to manage who calls who. And then the people area of Planning Centre, we've been able to put all the questions that we need asked and answered, and the ability to capture when something needs to happen, so to escalate from an answer that someone gives. And so, yeah, I think Dan's probably best to show you how he's set up Planning Centre now and the result that we see on a sort of combined page.
So yeah, Dan, how does all this work? We're just rolling this out now. It's taken us a few weeks to get it to this point. I'm so grateful we're at this point now. So, and I'm hoping and praying that this becomes part of the way we do things from this point on. It's forced us to innovate. So I'll hand to you. Show us what are we doing?
Yeah, well, I guess with the care, we wanted to go about it in two ways. How do we connect with people in our community externally, but also internally with our congregation? So we had to come up with two ways of doing that. I'll show you externally and through our website. Stu's done a great job of making this pretty obvious of how you can get help. You can see here on our website when you first go to it, you've got how can you connect with people online, our Sunday services. And right here, it's need help. And when you actually click that, it takes you straight to a form. So this is a form that you can do within Planning Centre people. Neil mentioned there that we started off with services, and then we from there looked at what else we could be using. And yeah, we came up with the fact that in people, which is actually free, it's a free part of Planning Centre, that you can then build different forms. And those forms, as you can see here, is collecting people's name and email, and then asking how best we could be helping in the situation. So that's how externally that goes to a, let me just, that goes to our workflow. Comes in here, and that's where then we work through how do we actually meet that person's need. Who do we need to contact? What is
So
it?
we probably should define what is a workflow.
A workflow. So you can see there, that's the forms. That's where we have the forms. Here is a workflow. You can see here that it comes to me. I get an email saying that there's a card, which is someone's name. It comes here, and then I go through these steps, which here it's saying determine what they need, call the person if I need more details, and then as that person, as I've done that, I can then say complete, and it moves them down the list until we can say, all right, let's take them off the list because they've met that need.
So the other thing, Dan, worth mentioning here is what you're showing at the moment has got nothing to do with anything we've built that's bespoke. This is available out of the box in Planning Centre, and it's actually in the free section of Planning Centre. So anyone watching at the moment who wants to could implement what you've done so far. That's
right, correct. And that's every time. So when I go back to the forms in there, that one that we had up on, that's it always creates a public link for you to be able to use to put up. So we use that also for we were using it initially for our events. If we had any events that we're wanting to book, we'd have the form up on our website, or you could reach it. So when we move to then how do we create that care network amongst our team, we're really passionate about making sure no one stands alone. And so we wanted to, in this moment of crisis, how do we make sure everyone's getting a phone call? How do we make sure we're hearing how we can be assisting and helping people in our congregation? So that's where Neil did a great job of putting together this care package, which you can see here. I assume it's still sharing. Yep. And so yes, Matt will blur out his details there, but it always comes up with if we've got a picture for them, their contact details that we might need to help contact. But this is to be used with our care team, our contact team, so that we can quickly gain, are you doing okay? Is there anything we need to follow up on? How are you going connecting with us? Are there people that you feel confident that can be praying for you? And how regularly would you like us to keep calling? And for us at Citywide, important group we have is called Kingdom Cells, where we're getting people to get together in twos or threes, maybe four, but really having that deep conversation of, again, asking how you're going and praying for each other and challenging and caring for each other too. So we want to know if people are in that group, but we can actually already see here in connection with our groups, if they're part of a life group or not. That comes up on that top tab there.
So that bit's automatic, that if they're in a life group already or in another group, that it comes up as part of that automatically.
That's right. Yeah. And there's bits here of for example, the person calling, they can see any past information that they put up in that group, as well as down here, these notes will always be there if you put in a note. What I wanted to really work on this to be a casual conversation that you would have in catching up, because although we might have people coming to our church for the first time and we want to touch base and work out how we can connect and join that person into our church, we also acknowledge that a lot of natural connections are already there, and we wanted to make sure that this can flow well with that it actually is a way that if you're catching up with one of your friends from church, that this is just part of the kind of casual conversation that comes up, and actually they would love more assistance in this, or they'd like to know how they could be more connected to a life group and things like that. So we want to work together with our congregation
So who is filling this form in?
So this form is filled in by our connection team, so more kind of administrative. But at the same time, that would go, or there'll be a second tier of a pastoral care team, and they will be the team that has kind of those connections. It could be that maybe in a moment of crisis, this information becomes helpful for them to assist and to pray and to walk with this person, and then once the crisis is they can then step back to let other members of the congregation who are already around them or be connected with them in that sense. Yeah.
And what are the follow-up options? What does it say? Action follow-up.
Yeah, so when you go follow up, so for example, around action, so maybe it's that we've had someone fall on hard times and they need a meal or they need some food. And so you could pop in there what kind of meal they need, or that's a paragraph there you can pop in any text. That then, so this is now showing you a bit behind the back end. This is what Neil's programmed. So behind there, that comes into here, which is also, again, in Planning Center. It's in people in the customized fields. We've added an extra custom tab there called Care. And that's then where we've got all these questions that are connected with the what you just seen before. So that's where it comes in. And then I've made a list. So there you can see myself and Matt in there. This list picks up anyone that has ticked the follow-up box. So this will refresh every day. It will pick up if there's anyone that's ticked that button, and then from there it gets sent automatically to this workflow as well. And then again, I'll get an email, or whoever's helping run that will get an email to say that there's some follow-up required. And
so what kinds of follow-up would be required?
So, for example, going again with that food example, that I can see that someone's asked for a food package or would love some assistance there. So I would then contact the leader. We've got different ministry groups in our congregation that have offered to help provide food or to help run errands to get things for people, help them get connected to the online, or even just a handyman for jobs around home. So that next step there kind of has a list of people that could help, and that then helps me to pass forward that information that's needed.
So you have a list of people, so you have the teams listed there somewhere who can.
Yes, yep. So that's in this one here, in contact a leader assistance, and then a follow up there. Yeah. Would you like me to?
Yeah. Show us what.
So we've got there Laura, who's been doing a great job of connecting people online for us. We had a couple of people this week actually join us online, thanks to Laura's work. We've got Janine Collins, who's been working really hard on making some meals with Sharon, and they've got a freezer full of meals at the moment. And we've had one person contact us through the website that we've been able to get some of those meals to, as well as connect them with their neighbourhood house for some food packages. We've got Harm Kanib, who's offered to be able to pick up some groceries or get some medicine, and also I believe he's assisted in some medical things because he's got a medical background, so he's helped with that. I've got there Morris French for any financial assistance, just someone to hear and be able to walk with people in that moment. And Graham Pickett, who's helped lead our men's ministry, has offered to be able to network with the guys if there's any needs for projects around home or things to be fixed. So
you would assign the card to one of them. That's
right. Yep. And they would then have, of course, checking with the person that they're happy for that information to be forwarded on, because at this stage only the person recording and myself would see that information. And then with their permission, I would forward it on to that person leading to help get the help they require.
So we set ourselves a goal at the start of all this, that we want to make sure that we're connecting with everybody as much as they want us to, but really for some people at least once a week, and others maybe even more regularly than that, depending on what situation they're in. And that we were finding ways of responding to needs. And this is our strategic way of doing that. How many people can this system handle? How many people can we use to? Well,
the people, I think that's free, and I'm not totally aware of what the limit is. It'd be over 500, maybe 1,000.
So maybe just to weigh in there, we're also using the groups functionality of Planning Center. I don't think that is free, but it's not much, and probably that would be the limitation, and that the limits would be on how many groups Planning Center, like you would pay more to Planning Center for more groups, but I would imagine it's nominal, and you probably get 100 or 500 groups in the first tier, which is adequate for as many groups as you need, because you need a group to put people in a
That's right.
team for a call to call.
We're
so
using here a test care group, and I've selected our map there. But you can see here Dan's contact list, and if I was to expand that, that would actually have all the list of people that are in my group to be contacting and connecting with.
Okay. And so how many people have contact lists?
So we've tried to create a bit of a network of myself and the team around that, and then working through our life groups. So all of our life groups have kind of been encouraged to, during this moment, to keep track of how their people are going and just any needs there. And then we've acknowledged there's people that aren't in groups, so we've created a list around those people as well, and created this network. Even Time Out, which is one of our ministry areas, they've kind of allocated different people to have a list to call.
So is there anything else? So is there anything else be helpful to communicate in terms of how this system works?
No, I think, like I said, we really want this to be something that is intuitive. It is something that, as we make these calls, it helps us to actually ask the questions that need to be asked in this moment, as well as not be too invasive as well. That's part of it. It's not that we're keeping tabs or recording. We just want to make sure that people are asked the question, are you doing okay? And actually, how do we get the answer to that to the right people to be able to help? So that's really our heart in this, and how do we make that work that's not creating any barriers for people.
Yeah, I love that we're building on something that already existed, and that at the heart of this care system is the assumption that different people have different skills, and so some people actually just need someone to come and fix a tap, and if they were to turn to me to do that, they're not going to end up with a tap fixed. But there are other people who know how to do that, or others know how to get them online, or so that's built into this. From your end, Neil, is there anything else we could be communicating in terms of for others to understand how this works in practice?
Well, it's probably worth mentioning that, like you talked about, the way we've implemented it through the handyman and other aspects, but that was completely done within planning centres. So Dan envisaged that need and has implemented it that way. No one else would have to do that in that particular manner, because planning centre has that flexibility to implement however you want to. The wrapper that we've built, the Citywide Care wrapper, it's probably not the best word to use in this environment, but technically that's an agnostic system, which is probably not how you want to sell a church system. But what I mean by agnostic is it doesn't care about the data that it's like. All the data is coming, so all the questions are coming from planning centre and the answers are recorded in planning centre. So there's nothing about the wrapper that determines what you have to do. So the list of questions that you would want to have are completely done in planning centre and are completely discretionary. And in fact, Dan's actually on an old copy of the care page there because he's changed the questions recently. In fact, if you hit refresh, Dan, and go back in, it probably demonstrates how easy it is, because Dan's just changed the questions in planning centre. And so once this, just refresh again because you've logged out, is all that is. So once Dan does this and goes in, you'll see that the questions in the care wrapper have updated because it's picked up the new questions that Dan's just done in planning centre.
And so if other churches were interested in using something like this, what level of technical expertise would they need to implement it?
We'd obviously need to just bundle up the wrapper to supply, but then essentially the steps were to create a tab in people, a custom tab in people called Care, and to create a group category, I think it was called, in the groups area called Care. And then this system looks for those, and it uses the groups to determine what's going down the left-hand side, and it uses the custom tab of Care to determine the questions that get shown here. So if you know planning centre already, there's really nothing you need to learn.
I think it's worth mentioning too that Neil's built in too is last contacted and how long ago. So that's also helpful for us to know who's on the fringe or who hasn't been contacted and how recently.
Yeah, it's so important. Well, one of the things I've had to come to terms with is I want to just be able to personally care for everybody, but it's not humanly possible for a person to care well for a group of more than 20 people, actually. And it's not possible to keep everybody in your head. So we need some way of making sure that nobody goes missing. Because one of the things we do say regularly is that we don't want anybody to stand alone on the journey of life, and particularly in a moment like this. So having a field like that is just so helpful. So I'm just so grateful. And I guess, Neil, if other churches are interested, they can just contact the church and we can let them know how to take it from there.
Sure.
Yeah. Well, thanks, guys. Really appreciate your work as from my end as the senior pastor. Just such a relief to work with a team who can innovate like this and help us find a way forward. You know, and really having to innovate very quickly in a whole new situation. But like I'm saying, I think we will be using this system for the foreseeable future. It's something that we've had to innovate, but I'm grateful that it allows us to find new ways forward for the future. So until next week, that's probably this episode of Citywide Cogs done and dusted.